very warm welcome to you all. We're delighted to have you here.
Thank you.
The floor is yours.
Great. So, can we have the first slide up? So, good afternoon. Today we're going to be presenting to you our project which is looking at tackling prisoners' social contact. So this is the team. It's a multidisciplinary team from operational colleagues, policy and digital from across the MOJ and other civil service departments. This project was the brainchild of Amber, who's been an instrumental part of the team, working with us throughout to really develop this idea and flesh it out. Amber, unfortunately, is no longer going to be with the civil service, but she's here today to present to you. So over to Amber.
Great, thank you, Julia. Reoffending is really expensive. It's a massive problem for our economic and social society. It actually costs a whopping £18.1 billion a year, a statistic I don't feel many people are aware of. It's also a really complex problem to solve, and it's not something that a simple data solution can pick up. However, we do have a clear indicator of something that might help. Prisoners who are isolated typically reoffend more. Research shows that if we can reduce the isolation of a prisoner, by 30% reoffending will be affected. It's a very clear statistic. However, we have another problem. The data just isn't there. We don't know how isolated prisoners are. It's really unclear, and it's very hard to figure out what to do if you don't know if a prisoner is isolated. How are you going to get a manageable intervention to drive that better behaviour, which then won't lead to reoffending? So we came up with this challenge statement. How might we identify isolated prisoners so we can reduce their likelihood of reoffending by designing tailored interventions that reduce their isolation, increase their well-being, and reduce the associated risks of self-harm and violence? I'm going to hand over to Chris now.
Thank you. Prisoners have social contact through a number of different ways, through face-to-face social visits, through video calls, emails, phone calls, and so on. The issue we have at the minute is obviously we're creating a lot of data whenever this happens, but it's dispersed. It's not all in one place. And by that I mean not only that it's held on different systems, but in some cases it's held by different organisations where the MOJ has contracted out a particular service to a third-party supplier. So our idea is really simple, really. We want to bring together this data into a single centralised data store, and then we want to work with all the user groups that we've identified, and we'll go through it a bit later on, to co-design and build applications and services that will transform the way that they can identify, manage isolation in prisoners. And the two lenses we think that is going to return the most value are, first of all, for staff working in prisons, so frontline staff, who need to be aware of isolation in their population. And the second lens is for staff working at the centre, staff working at MOJ HQ, who will be able to use a much richer data set to derive insights that feed back into new approaches and new policies. And Pete's going to explain a bit more about the benefits of that approach.
So if we can develop some isolation metrics, what are the benefits? Well, the answer is they're large. Firstly, for prison staff, so if there was a data tool that could indicate where prisoners are isolated or at risk of isolation, they could immediately be drawn to their attention so they can develop interventions to help them. And that flows on to the second benefit, which is for the prisoners themselves. Isolation, any tool that helps reduce isolation is good for the welfare of the prisoners whilst they're incarcerated. The third benefit flows from that is for the public. The link that we started the presentation with shows the connection between prisoner isolation and reoffending 3 years later. So therefore, if you can find a way of reducing isolation, the benefit will flow through in due course that reoffending might reduce. Now, reoffending is a word that's just an idea, but what reoffending means is fewer victims of crime in future. So it directly translates to the welfare of people on the ground in the UK. And then the final benefit that flows is the government itself, and it's a financial benefit, and it's connected to the amounts of pounds that are saved by reducing the reoffending in due course. Over to you, Julia.
So we see the potential users and beneficiaries of this data as being, as you can see here, across from prisons and those who work in prisons. I've spoken to safer custody officers who say that they wish they had this would be vital for them. Obviously then the Ministry of Justice, That's my background. I can see many policy uses for this sort of data and working with analytical colleagues to get really meaningful evidence-driven policy. And of course, the benefit to the wider government, not only from providing better evidence-driven policy, but also saving money in terms of reoffending. And then we have external organisations working with third sectors, charities, looking at bringing them in to deliver targeted interventions, and of course sharing these rich data sets with trusted academics who can then do some really meaningful research on that. For example, Officer Smith is working in safer custody. She notices that one of the prisoners in her key work group has moved from green on the isolation metric to red. She's able to use that data to have a targeted conversation with him. She finds out that his son, his only family member, has moved to Australia and he can no longer make the scheduled time for the phone calls due to the time difference. She's able to use that, speak to the son, and move a video call to a time that works for both of them. It's a simple, cost-effective intervention that means that that prisoner is getting back on track, making contact with his family. And for a policy advisor, we can look at prisons that are using specific targeted interventions, and using this data, we can see whether it works or not. We can see whether social contact has improved and whether that's had correlations with in-prison assaults, self-harm, and those sorts of behaviours. From that, we can then derive evidence-based policies that get the right interventions into the right prisons with the right prisoners.
So what next? Well, the next steps for us would be to develop the idea more deeply, to go through the details. We've got an idea of the scope of the details, but start to work through them with a view of turning the concept into an MVP, which could then be rolled out in a pilot, possibly at a suitable prison, just to gather some data, to understand the problems and the pitfalls, and to see what comes out of it and how useful the data is at the end. From there, we would imagine that if that proves successful and the value is confirmed, rolling it out more widely across the prison estate, so it could become a generic tool for across the entire estate for people in terms of the way they administer prisoners whilst they're inside there. And then finally, looking beyond that, we see possibilities beyond prisons completely. In the current environments in the UK where loneliness is an epidemic, some would say, we see opportunities for being able to gather isolation metrics for all sorts of vulnerable people to help social services to intervene and assist with them. Obvious examples might be residents of care homes or long-term patients in hospitals, people who naturally become isolated by virtue of the circumstances they find themselves in and perhaps their age as well. So we see great potential benefit, not just in the context of prisons, but wider, and of course the benefits flow in two areas, saving money and also improving the welfare and the quality of people's lives.
Great idea, folks, and thanks very much for all your efforts. Great presentation. Thank you.
Thanks very much.
Thank you very much. Thank you.